Wonderful. Thank you, Katie, and thank you to everyone who's able to join us today. And so happy to have this recorded so that people who couldn't be here today are able to participate and watch in the future. My name is Eric Lenzer. I work for the County of Sonoma. I am the manager of the In-Home Supportive Services Public Authority, which is, we'll get into what IHSS and the IHSS Public Authority is in a little bit, but I wanted to take a moment just to welcome all of you to the first of our Aging and Disability Education series. And I'm really excited that we're starting off this project of community education in the space of caregiving. Katie, can we go to the next slide? I think a great caregiving is such important work. And I love this quote here from Rosalind Carter. I'm going to take a minute to read it for us today. That there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. One of the things that I like about that is that it really sets the tone for how prevalent caregiving is. All of us will be impacted in the caregiving space at some point in our life, and wanting to take some time to think about that more deeply, to consider what the impacts are on our individuals and in our communities more broadly, and be able to do some collective thinking and imagining about kind of how we can best support and engage caregivers. So excited for that to happen today. I also want to take a minute to recognize that November is Family Caregiver Appreciation Month. That's a national designation. Our country as a whole has taken the step to say caregivers matter, and we want to take some time to really elevate that in November. And then locally, our Sonoma County Board of Supervisors this month has also designated Sonoma Caregiver Appreciation Month for Sonoma County, the month of November. And I think it's important too that this is a big issue that's impacting our country broadly, but it's a local issue too. One of the quotes from that proclamation is that 1 in 4 households in our county are caring for an individual over the age of 50. This is everywhere in Sonoma County, and we need to take some time to educate ourselves and educate our community about caregiving. So happy to be doing that today. I think Paul Dunaway, the director of the Adult and Aging Division, is gonna kind of walk us through what our next hour and a half will look like.
Yeah, thanks, Eric. Welcome, everybody. Like Eric said, my name is Paul Dunaway. I'm the director of the Adult and Aging Division here in Sonoma County. I just wanted to add to what Eric said about the importance of caregiving. Just something as an observation, how much the Westernized culture has swung to independence and prioritized independence, and how so many other countries in the world recognize the importance of staying connected, and especially to family, and how that relates to aging needs. And when we are dependent on each other, it really should be discussed as an interdependence that we all have across our lifespan and at different ages. That if that were truly the focus, we remember that we may have needs, each of us or others that are close to us at different parts of our life. 1 in 4 is an extraordinary number of people that will rely on some sort of caregiving throughout their life, and needs to really be a call to action, if not our war cry, that we should focus on as we think about this work. Like Eric said, November is Caregiver Appreciation Month, but it's also Alzheimer's Awareness Month. Shelley is here from Alzheimer's Association in our local chapter. In our agenda today, you're going to hear from different organizations. I'm going to ask them to introduce themselves in a minute, and they have a presentation that they're going to be going through for you. They'll talk about their common challenges and the areas of focus and need within each of those areas. At the end, I want each of you to be thinking about calls to action of different things we can do locally to move some of the work forward. for Sonoma County and the people that live here. So I will do a little bit of a wrap up at the end and then invite you to participate in a conversation of things that you hear as well. I also just wanted to acknowledge Katie Parrish sent out the video, the title Facing the Faces of Caregiving. That was a very touching video. It's a 4 minutes and 40 seconds, if you can spare that amount of time. It just was through the perspective of caregivers and the impact of what that is. First of all, the importance of it and the stresses of how much caregivers go through and the people that they care for. So without further ado, I will turn it over to Alzheimer's Association, and then we'll go through the different organizations who are here. Shelley.
Okay, I'll need to share my screen. So there we go. Thank you. Okay, everyone see the screen, my opening slide? Okay, perfect.
Yeah.
Again, I'm Shelley Dombrowski, Senior Regional Director of the Alzheimer's Association, Northern California, Northern Nevada. And I also have with me Jessica Rothar, who is our Senior Public Policy Manager, who will talk a little bit about kind of our policy and advocacy needs. So thanks, Paul, for recognizing it's also National Alzheimer's Disease Awareness Month, but we're here today to really recognize kind of in the many caregivers throughout the nation and locally that provide the often unpaid care. So my statistics are around dementia caregivers, and of the 6 million Americans living with Alzheimer's, we want to honor those this month, the nearly 11 million Americans who provide unpaid care to individuals living with Alzheimer's and other dementias. Bringing that to the local level, there's approximately 11,000 individuals 65 and older living with Alzheimer's, and we also want to honor the nearly 25,000 family members and friends providing the unpaid care here in Sonoma County. At the Alzheimer's Association, we want to make sure that no one faces Alzheimer's disease alone and that we are here to help. Caring for somebody with Alzheimer's or related dementia can be overwhelming and sometimes challenging, and many of them feel very much alone. So to help relieve the burden that a dementia diagnosis can impose and give family members the tools that they need to better manage their roles as caregivers, the Alzheimer's Association offers a 24/7 helpline available around the clock, 365 days a year. And through this free service, specialists and master level clinicians offer confidential support and information to people living with dementia, caregivers, family, and the public. Through our care consultation services, local professional staff can assist with navigating through the difficult decisions and uncertainties people with Alzheimer's and their families face at every stage of the disease, which includes assessment of needs, assistance in planning, problem solving, supportive listening, community resources, and more. And since caregiving doesn't come with an instruction manual, we really encourage caregivers to attend classes to better manage their roles as caregivers. Available online, and now most of them in person. We're getting lots of requests to be out in person now. Our education programs features information on topics including the signs of Alzheimer's disease, obtaining a diagnosis, effective communication strategies, understanding and responding to dementia-related behavior, living with Alzheimer's, and our 6-week Savvy Caregiver training program that's funded by Title IIID Health Promotion Grant through the county. And we also encourage caregivers to join support groups to share about their own experiences and get help from others in the group. We offer peer or professionally led groups for caregivers and others dealing with the disease, with 14 virtual and in-person dementia caregiver support groups throughout the North Bay and which includes specialized groups such as a spouse partner group, 2 adult children evening groups, a weekend group, and we've actually over the last year started a grief group. And we have a unique support group that we offer for those with an early stage diagnosis, either mild cognitive impairment or early stage dementia, to comfortably engage and come together and connect with others who are on a similar journeys. Those with an early stage diagnosis and their care partners come together, but they meet in separate groups with a trained facilitator. Our North Bay offices currently offers one in person in our Santa Rosa office and one virtually throughout our Marin office. And then there's a variety of virtual groups throughout the chapter as well, including 2 younger onset groups. And then lastly, we offer a variety of on-time tools, information, support through our ALZ website. So I would be remiss if I didn't honor our volunteers who help us in the work that we do. With the help of volunteers in such roles as community educators, support group facilitators, community reps, and public policy advocates, in the last fiscal year, we reached close to 2,200 unduplicated North Bay constituents through our helpline education and support group programs, which was a little over 1% of the 65 and older population in all of 5 counties that we serve. We've set higher goals, of course. It's always a new year. So our goal this year is 2,700 unduplicated constituents. And we could not achieve this without our dedicated volunteers. So we were asked to give an example of a caregiver who was able to utilize our services over the years. And Gail T came to mind. Gail was a care partner for her partner, Carol, who was diagnosed in 2021. And I reached out to her to get some insight on exactly how our services helped her through her caregiving journey, which is still continuing. First thing Carol said was, the Alzheimer's Association became my lifeline to resources and understanding of the disease and potential challenges that may lie ahead through their caregiver education. The early stage support group was a wonderful avenue for both myself and my partner to share our feelings and support others during those early years. Caregiver support groups gave me a feeling of camaraderie with other folks who gave me perspective on their journeys to help me through mine. Utilizing the 24/7 helpline offered crisis assistance and tools when faced with predictable behavior, unpredictable behavior, or situation on the spot. One-on-one care consultations with local staff gave me insight and guidance into disease progression and behaviors. And then I did ask Carol, give me one area of greatest need that she felt in Sonoma County. And she said, from firsthand experience, I feel police officers, firefighters, and even doctors need more training in understanding the disease and learning how to communicate more effectively with a person with dementia. And then she went on to talk about her biggest challenges over the years in her caregiving role, basically being thrown into the unexpected role as a caregiver and being a life support to another human being. How do I manage the unmanageable when the person is in denial, the unpredictableness of the disease, the challenge of keeping up with my own responsibility and health issues, and the challenge of continually shifting gears when behaviors change. So I thank Gail for giving me her insights. And now I'd like to turn it over to Jessica, who's going to discuss what some of the top policy and advocacy needs are of the Alzheimer's Association at the state level right now. And also she'll probably give us a couple of action items to support caregivers. And I'm going to stop sharing my screen. So Jessica can come on. There you are.
Hello, thank you so much, Shelley and everyone. And I apologize for not having slides. So I think I'm so glad to see Nancy Powers Stone, who is a much better person than I am to talk about the totality of what caregivers need. But I want to focus on an aspect that is, I think, quite unique for people with Alzheimer's and dementia and their caregivers, which is that after they receive this life-changing diagnosis, a diagnosis of a fatal, incurable disease, typically what happens is the doctor says to them, "I'm very sorry, you have Alzheimer's. Here's a prescription for some drugs that may help a little bit. Good luck, God bless, come back and see me in 6 months." And they may be handed a packet, a very thick packet of a bunch of information that the caregiver is absolutely too freaked out and overwhelmed to take in. And that's it. And then they're sent home. And something that we typically see as caregivers come to us is this. They describe, then they go home and frantically start Googling. I went through this experience myself with my grandfather. Our family had no idea that there was something called an area agency on aging that was where we were supposed to start. And of course, we never got a diagnosis. We just had to figure it out for ourselves. So for us, one of the areas we're trying to work on is this huge yawning gulf, this chasm between the healthcare system, which says incurable disease, can't help you, goodbye, and our social care system. How do people find it? How do they get connected? And so we are going to be introducing legislation in the state legislature next year that aims to address this gap by creating a pilot program for 5 participating counties or regions that their aging and disability resource centers or county public health departments can apply for a dementia care coordination pilot. And what this would do is it would provide the resources that would allow the counties to build partnerships with the health providers that would create, essentially, with patient consent, a warm handoff system. We used to do it, it was called fax referral. You get a participating health provider to ask upon diagnosis, ask this patient, can I share your information with our county dementia care coordination specialist? And they will reach out to you to help you figure out what next. So with the patient's consent, there's then resources for the county to either hire or pay somebody who's already got this capacity, a dementia care specialist who can reach out to the families, help walk them through developing a care plan, and then connecting them to the resources that already exist that could help them. Your state senator for Sonoma County, Mike McGuire, is about to become the most powerful legislator in the state Senate as he becomes the president of the state Senate in January. And so if this is something that Sonoma County might be interested in and might be interested in helping us engage your state legislators on, too bad we're losing Jim Wood. That's a big loss. Please reach out to me. I'll put my contact information in the chat. And then the other thing I would say is, and significantly, we are going to ask for serious money. This is going to be $500,000 for these pilot projects. And we have the capacity to support in the building of partnerships with the health providers because we have a whole health systems change program that's working out to do that. The other thing that we are trying to do is, of course, to increase access to dementia competent care and support. And back before Arnold Schwarzenegger cut a bunch of funding for aging and senior services, there was a network of Alzheimer's and daycare resource centers that ended up being defunded. And one of the challenges, we've been trying to get these refunded for years, and the problem is that the state wants to see that they're sustainable. They provided this wealth of service, from adult day health care to caregiver education and support, to public education, to even training and education of health providers. And they were not sustainable. They cost more for these rich services than they got. And so we are now working with the state and a network of 7 adult day health centers, including the former Calabria Care in Napa Valley, to work on developing a model that can actually show a sustainable path that would enable, with state funding, federal funding, for this to be a sustainable model. So one of the things we're asking the state legislature for is another $5 million to continue that work. So it doesn't directly create new services in 1 year, but what we hope is that by working with the academic researchers that are part of that project, that we can actually help essentially rebuild those Alzheimer's day care resource centers in a sustainable way. So the final thing I'm going to share is that I was asked to address the question of what are 1 or 2 actions that you recommend people can take. And I'm just going to say, if you or someone you know is or has been a caregiver for a person with dementia, share your story. Legislators, elected representatives, make decisions not based on data. Unfortunately, if they did make decisions based on facts and data, we'd be in a very different place. But they make decisions based on what their constituents are clamoring for. And one of the things that we hear over and over again at the state level is that they're not hearing from people talking about aging. And you may notice there's a lot of money given to things like a child care tax credit and help bolstering the child care workforce. And I think what happens is, in the aging field, we're just all too polite. And people still have this traditional belief that you're going to have a wife or a daughter who's going to take care of you when you're older and need help. Some of us do not have daughters. And so it's time for us to really get good at the district level advocacy that is what really makes change happen. So I dropped a link in the chat. What the Alzheimer's Association does is we bring people to meet with their elected representatives at all levels of government to share personal stories about your caregiving journey related to Alzheimer's or dementia. And then we couple those with specific policy asks to make things better for people who are just starting out on their journeys. And it ranges from everything from finding a cure for Alzheimer's to better diagnosis and clinical care in the medical setting, and more support for caregivers who are carrying the brunt of this. So I'll close there. Thank you so much for giving me the time to share what we're doing.
That's fantastic. Thank you both. I'm actually going to call out a couple of things that I heard in that. And then remember, I'm going to ask the audience to call out things that they heard as key takeaways too. But Shelley, how you started with more information and knowledge for first responders and how to respond to people during times of disaster. There's going to be more of that happening. And I agree that that needs to be something that we all do together to educate people who are responding to those in need or in their own individual crisis in that moment. Jessica, I'll already volunteer us. Whatever we can do to help be a conduit for our own Senator McGuire. Let's take advantage of somebody who represents our district and who is going to be in a tremendous position of power to bring this voice to the Senate for us. So thank you for raising that. And I love the idea of sharing your story. Why each of us feel like we need to be hidden and not share what's happening to those that we are caring for, or when we are in need of care. These stories need to be out there for all of us to experience and to share with one another. We need to create a system of improvement here. Last thing I'll comment on is some of us have daughters, but not all daughters can stop their lives to care for somebody. And that's just exactly what it takes sometimes. And that's not the system that we should create for everybody. Okay, thank you very much. Nancy Powers from Redwood Caregiver Resource Center, you're on deck.
Here we go. Let me find where I'm supposed to be. Give me a little chance here. So I'm Nancy Powerstone from Redwood Caregiver Resource Center. We serve 7 Northern California counties with support for families who are taking care of other family members. So I'm going to go through this, and boy, am I going to talk about daughters. So our mission is to improve the quality of life for family caregivers and the people who receive their care. I'm going to give you a quick little background here because I'm actually going to get into a lot of data about who our caregivers are, who's actually taking care in California and in Sonoma County. Who are these caregivers that we're talking about? So caregiver resource centers have been around since 1984. We're the first statewide, state-funded caregiver support program in the nation. And it is the model that the National Family Caregiver Support Program that's funded through the Area Agency on Aging was modeled after. There are 11 of us serving every county in California. And Redwood serves families who live in Sonoma, Napa, Solano, Lake, Mendocino, Humboldt, and Del Norte counties. Who do we serve? Who's eligible for our services? Family and informal caregivers of people that have Alzheimer's and related disorders, Parkinson's, brain injury, stroke, and other adult onset cognitive impairments, and also caregivers taking care of adults that have chronic health conditions. And so we're looking at frail seniors, looking at how many ADLs they're needing help with, to also qualify them for our help. So we have an expertise in neurocognitive impairments, but we also serve those caregivers taking care of older adults that have other chronic health conditions. We serve all income groups. There's no means qualification. And originally, the CRCs were put together to really address the needs of that missing middle income who don't qualify for public assistance programs and who are unable to pay for care on their own. We are now housed, we've had a couple of changes, the statewide system. We started out in the California Department of Mental Health, moved to Department of Healthcare Services, and we landed in 2023 in the California Department of Aging, along with our partner Area Agencies on Aging. So that's where most of our funding comes from. There are now almost 7 million caregivers in California. Things are really changing. I've been working with family caregivers for 30 years, and the demographics are really starting to shift more. We're seeing more and more changes. Caregivers are getting younger. 80% of the caregivers we serve are under the age of 65. The caregiving population is becoming more diverse, and over 50% of caregivers are in the workforce. It's higher than that in Sonoma County. And caregivers are using technology more and more in their daily caregiver work. So what are the needs of family caregivers? Like I said, I've been doing this for 30 years. So the way we serve people is changing. Times are changing, but the needs of family caregivers remain constant. They need education about diseases and direct care and medical needs. They need emotional and psychological support. It's often very, very taxing. They need respite care, and I'm going to talk about this a little bit further on, that's affordable and accessible, available. They need help with managing activities of daily living and home safety, behavior management and communication skills. They need connection to resources and community support services. And they're increasingly needing help with learning how to balance work and caregiving. So what are the services that Redwood offers locally in Sonoma County? We offer information and referral, so people can call up and ask about information about their caregiving needs. We offer a uniform intake and assessment, and by uniform I mean the California Caregiver Resource Centers have a standardized intake process and a standardized assessment. We're currently doing the assessment on a couple years old, online service data collection and service platform called Care Navigator, right? CareNav. And so what that means is that now a caregiver who might be working, an adult daughter, which we'll see percentage-wise how many of our folks are adult daughters as I continue, after work can go on to CareNav through the portal, the statewide portal, or through the RCRC website portal, and they can start their own intake. They can also start their assessment process. They can ask to be contacted by a family consultant. They can pull out onto their own dashboard. They can pull down fact sheets. So they can do this at any time of the day or night, and it's a fabulous resource for folks who are inclined to like to do online services, as many of our younger caregivers are. The assessment itself looks at different domains of caregiving. It looks at caregiving health. It looks at what kinds of caregiving tasks are you doing? What are your finances like? Are you a veteran? Can you, what is your, are you depressed? Are you feeling isolated? Are you feeling lonely? What is your burden? How burdened do you feel in your caregiving? And what kind of plans do you have for the future? Like Plan B is what we're always talking about. So after an assessment is done, either it can be in person, it can be by phone, it can be in our office, it can be online through Care Navigator with a family consultant who is a master's level social worker. A care plan is created for everyone who has an assessment process in conjunction with the caregiver and the family consultant. And it's put together, it's informed by what's reported in the assessment by the family caregiver. So that's really key. We don't decide what people know, what people need, families decide what they need. So it's very consumer directed. Folks can also have ongoing consultation after that after that. Also, after an assessment, people are eligible for short-term counseling. We pay for 6 sessions of solution-focused therapy that can either be done in-house with an employee eligible to provide therapy services, or with contracting therapists in the community. We provide legal and financial information and consultation. Often people need to know, what do I need to do with our finances if I'm looking at perhaps needing to place my loved one and I don't have a lot of money? Is there a way to become eligible for Medi-Cal without becoming reduced to penury myself? And so that can be really valuable. We offer respite vouchers, including consumer-directed choice options along the lines of in-home support services, where a family can choose their own respite provider, hire that provider, and we will reimburse them. We also provide out-of-home respite. We also provide daycare. We provide chore and homemaking and whatever people need, long or short term. The caveat here is that it's based on funding available. We have different pots of money that we put together for people so that we can maximize what they're getting. The greatest need, because we deal with so many people with neurocognitive impairments, is for in-home supervision. So that's our greatest need at this time. We offer psychoeducational interventions, 2 of which are funded by our contract with the AAA, Title IIID, Health Promotion, Disease Prevention. One is called Powerful Tools for Caregivers, and one is called Stress Busting for Family Caregivers. Those are both evidence-based programs. And we offer professionally led support groups, currently online and in person. And all of these services are offered in English and in Spanish. And we offer linkage to other community resources for people. So statewide, once someone is a Caregiver Resource Center client, they're also eligible to receive the services that are offered on a statewide basis. That's trainings, education, our fact sheets, anything available on the statewide website. I'm going to jump through this because I want to get to who caregivers are. So I am a real data head. It really informs the direction of our programming. Who are we serving? It's really important that we don't miss the mark, right? Where we don't think of all caregivers that are 85 and years of older, when our caregivers actually are younger, and the people they're taking care of are older, is what's actually happening there. So this data is from our just released annual report that is put together for us by the Family Caregiving Institute at UC Davis. And the data is just fresh from the end of October and the beginning of November. So this is from data that went into Care Navigator that they call out and kind of piece together. So this is in lieu of me giving you one person that got services. This is going to give you a picture of who got services, right? So almost 67% identify as female. Look at this next one, right? Look at the ages. Most of these women are 45 years old to 84 years old, right? A lot of these people are working. Almost 70% of our caregivers are still trying to work. So workforce support is a huge issue for us, right? And as we get down and I talk about who they're taking care of, you'll see how this is it becomes very, very, very challenging. So a lot of people in this age range also are taking care of children. 48, almost 49% are adult children. So since 79%, 76% are identify as female, guess what? Most of our people are daughters. Most of our caregivers are daughters, followed by 35% spouse or partners. So we're looking here again, we're dealing with middle income people a lot. 16% of the people that we served, the Caregiver Resource Center, was below federal poverty level. Majority of people are identifying as married or partnered. A high percentage, almost 90%, identify as heterosexual. 12.8% live in rural areas. That's an issue for a lot of our caregivers. And our majority identify as non-Hispanic white, followed by Hispanic Latino, and 5% have veteran administration benefits. So that's just a quick picture, but it's very, very recent and gives you a real picture of who our people are. What are caregivers doing? We also track this all through our assessment and is pulled out of Care Navigator by UC Davis. They're supporting their loved one with activities of daily living and instrumental activities of daily living. They're cooking, they're driving, they're dressing, they're bathing, right? They're doing their banking. They're making their doctor appointments. They're doing more and more medical nursing tasks. They're doing shots. They're doing insulin shots. They're doing PICC lines. They're doing all kinds of things that 20 years ago, our caregivers did not do on their own. They're managing memory and behavior problems. They're providing protective supervision. They're taking care of incontinence needs, wandering needs, and they're taking care of all of the care receivers' emergency department and or hospital visits and medical appointments. So check this out here. 30% of our caregivers have been providing care for more than 5 years. Look at the percentage taking care of more than one care recipient. And check this one out. 73% provide 40 hours of care or more per week. Considering most of those are women from 45 years old to 65 years old, and they're trying to work, that's difficult. 70% report no paid assistance whatsoever. 40% report no assistance even from family or friends, and 90% are providing high intensity caregiving. Well, what does this do to caregivers? So we know caregiving can be hazardous to your health, right? So these are reported in our data as well. Almost a third report, more than a third report that their health is worse than it was 6 months ago. 20% experience moderate to severe depressive symptoms and significant anxiety. 60% experience high caregiver strain, and that is looked at by, we use a Zaret burden inventory where people are able to sort of answer the instrument inside the caregiver assessment. And more than half have at least one chronic health condition themselves, right? But many, probably 60% of our people still report that caregiving at some level is really gratifying for them, right? Who are they taking care of? Most of the care receivers are identified as female as well, and they're now skewing older. Care receivers are older than caregivers, between 65 and 84 years old. And 36% are over 85, so the old, right? Most of them, 68%, have a diagnosis of Alzheimer's disease or related dementias, followed by stroke, Parkinson's, cancer, and brain injury. 45% have 4 or more comorbid chronic conditions. So care required by families is becoming increasingly complex. So this might look like a daughter who we're working with, who's taking care of a mother that has dementia. She's working. She's also having to do insulin injections. She's also maybe having to do wound care. She also may be having to do, other medications for hypertension, and 87% of our caregivers are reporting the care recipient's condition is worsening. And here's the big one that we know now that would inform our services and informs our focus on public policy for working caregivers. 44% of the care receivers that come through our system can never be left alone. Ever be left alone. It doesn't make sense when you look at who's working, who's providing the care, and what the other responsibilities are. So what happens when people take advantage of our package of services, which is really convenient for overworked, overstressed caregivers? It's all in one place, right? So when folks take advantage of all of our services, or as many as are appropriate for them, this is what they're reporting annually at our annual surveys. They feel more confident as a caregiver as a result of getting respite and consultation and an assessment and a care plan. They're better able to manage their care as a result of having education and support. They're more knowledgeable. They have more knowledge and awareness of how to access community resources. They understand the disease and disability better as a result of our education programs and working with their family consultant. They're better able to care for their own physical and mental health. Years ago, I had a situation where I was working on the original caregiver assessment across the state of California. And what we looked at from over time was that caregivers were getting sicker. And we thought, oh, we're never going to get funding if caregivers are getting sicker as a result of our services. And we went back and looked at what was going on, and we weren't measuring the right thing, right? As a result of our services and respite and our encouragement and our education, caregivers were better able to seek out physical and mental health care for themselves. And guess what? When you go to the doctor, they're going to tend to find something, right? And so we changed what we're measuring. We're now measuring, are you able to take care of your own healthcare needs, right? Caregivers are feeling less stressed, and they have increased confidence as a caregiver, so self-efficacy. So what are our challenges? Our program challenges, our CRC, what I'm challenged with is our access, digital access for people, internet access for rural communities, and digital literacy among caregivers. Language, access to preferred language materials, and the increasing need for bilingual staff, right? I'm challenged by equity issues, right? The need for ongoing attention to inclusiveness and cultural congruency in our response to the changing families, and distributive justice, which is increasingly limited resources and increasing need for services, right? How do we make a decision on who gets what all of the time? Priority policy and legislative issues, accessible, affordable respite care options. That means a caregiver workforce that is educated in dementia care, that is affordable, that is available. People have a hard time finding respite providers. I just want y'all to know that we provided almost $750,000 worth of respite last year through Redwood Caregiver Resource Center. And guess what? We pay on average $40 an hour. The other issue for people getting respite care is that a lot of home health agencies require a 4-hour minimum, which can be cost prohibitive for a lot of families, right? And even the respite grants we give, it doesn't go quite as far because a lot of caregivers want to just step out, okay? And workforce support to help caregivers remain employed. We're looking at longer, you being able to use your sick leave, which is happening in California, family care. Even if you get 12 weeks of medical leave in California or FMLA in California, if you have someone who can never be left alone, which is 44% of our people, it's not adequate. So we're still not, we're moving in that direction, but it's still not adequate when you look at who are these caregivers and what do they really need. Get involved, engage. This is exactly what we just heard. Engage with policymakers, find out who your Senate and Assembly representatives are, communicate your support for families by telling your own story, send letters and emails, make a phone call, schedule a face-to-face meeting. And here, this is a big one. Join the California Coalition on Family Caregiving. It is a coalition of caregiver advocates with open membership that tracks and makes recommendations for the former California Task Force on Family Caregiving that ended in 2019. So it's open. This past year, and open to all family caregivers professionals, we made recommendations to support 14 pieces of legislation. And then these are some resources and contact information. And that's it. I know that was a lot. So thanks for bearing with me. I get really excited about looking at all of our new data.
You do get excited, Nancy, and it's hard to keep up making all of my notes as you're going through all of those things, but that was a tremendous amount of very good information. Thank you. The slide about what they do, caregivers, and the supports that they provide, it's kind of no-brainer when you see the link between their own healthcare and how well they're doing, just with the level of things that they have to deal with. I was personally exhausted looking at that list. And not to mention how isolating it must be to working with people who are in such chronic need all of the time, around the clock, and you never feel like you can leave them, of course, I think was the point that you were bringing up. And then looking at the demographics of the people who are providing this care, I really like the slide about we need to provide services for people to be able to stay employed. Taking younger females who are working age out of the workforce is a catastrophe for that to continue to happen. So thank you very much for all of that detail, Nancy, and for what you do. Next, I get to introduce my very own Eric Glenser, our Public Authority Manager.
Yeah, thank you, Paul. I'm going to pull up slideshow here. So I'll reintroduce myself. My name's Eric Glenser, and I am the the in-home supportive services public authority manager. And so I'm going to talk with you a little bit about what the in-home supportive services program is and how it works, and then spend some time talking about the caregivers who are providing in-home supportive services in Sonoma County. So first, I want to take a minute just to look at what is IHSS. In-home supportive services, IHSS, is a Medi-Cal benefit. So this is part of the National Medicaid program. In California, we have Medi-Cal, and people who have Medi-Cal have the potential to access in-home supportive services if they meet the eligibility criteria for IHSS. It's a statewide program all across California. There's about 500,000 IHSS clients statewide who are being cared for by just under that many caregivers statewide. And it pays a provider, a caregiver, to help with specific tasks. You heard Nancy Power-Stone allude to this a little bit. The eligibility criteria for IHSS can be pretty narrow. So there are lots of people in our community that need care, and of those, not all and not many can qualify for in-home supportive services. To be eligible for in-home supportive services, somebody has to be aged, and in our world, aged means 65 years or older, blind, or have a permanent disability. That permanent disability piece also can apply to children who have extraordinary needs. So there are about, we'll see about 800 kids in Sonoma County that are receiving IHSS services in addition to adults and older adults. The other, some other requirements is that someone be very low income. You have to qualify for Medi-Cal in order to be able to receive in-home supportive services. I do have a little asterisk here because Medi-Cal expansion is happening across the state. More people are eligible. The rules for Medi-Cal have expanded. You don't have to be quite as destitute to receive Medi-Cal as you did 3 years ago, but you still have to be very low income. So people are very low income. And then the other criteria is being at risk of out-of-home placement. So you have to be at a point in your aging process or in your disability process where it's very likely that you need to move to a higher level of care, like a skilled nursing facility or a residential care facility for the elderly. And when you're kind of at that level of care, IHSS can come in and provide for care in the home instead of out-of-home placement. The IHSS program is task-based, and so here's a list of some of the tasks that IHSS can cover. It's not a comprehensive list of the tasks, but it's also important to know that IHSS does not cover all the tasks that we know somebody needs as they're aging. It doesn't cover assistance with mail and money management and paying bills. Like, that's never a service that IHSS can cover, and we know that older adults, people who are blind, people who have disabilities need that kind of assistance. It is able to cover many of the kind of domestic type tasks: laundry, shopping, housekeeping, meals, as well as personal care. If somebody needs assistance with things like bathing or toileting or transferring, and then getting to and from doctor's appointments is another key task that it is able to cover. I included on this slide too, I'll point out that if someone in our county is interested in seeing if they qualify for IHSS, the place to do that is through the Aging and Disability Resource Hub. So somebody can call or email and get information about IHSS and have a referral. I'm going to take just a minute to talk about how IHSS works. So when a referral is made to IHSS, a social worker is assigned to go to the client's home and do an assessment of hours. The social worker will make a determination if somebody qualifies for IHSS and then how many hours of care per month they qualify for. Then the state actually pays the wages of the caregiver who's doing the care. The pay rate in Sonoma County right now is $16.85 an hour. It's going to go up January 1st to $17.35. We'll see in a little bit who are the IHSS providers in Sonoma County, but you'll not be surprised to see that it mirrors what Nancy just shared with us, that it's and so these are people that are perhaps giving up their career or ongoing employment to take on a caregiving job that is going to pay them $17.35 an hour. In IHSS, the client has some responsibilities as well. And one of those key components is that the client is the employer. And this is actually really central to the IHSS model. In IHSS, clients have autonomy and get to choose who is going to come into their home, who is going to cook their food, who is going to touch their body, right? People should have choice in who is going to be providing them care. And so the client is the employer and decides who works for them, what days they work, they supervise them, and if they need to, they are able to let their caregiver go and find a different caregiver. This gives a snapshot of who are the age of IHSS clients in the county of Sonoma. Sonoma County actually is different than how many counties across the state, in that we have more people who are in that 45 to 64-year-old age group. We have younger adults with disabilities. A larger percentage of our county's caseload is younger adults with disabilities than most counties, which tend to skew older. Overall, there's about 7,500 people receiving IHSS services throughout Sonoma County, and they are everywhere in every community that you can think of, from as far north to south, east, and west. People are receiving IHSS. The IHSS public authority is sort of the caregiver side of the IHSS program. There are several things we're responsible for the public authority, but two that I want to highlight for this presentation are being responsible for new provider enrollment and maintaining a list of a registry of providers. Every IHSS provider, everybody who wants to be a caregiver in the IHSS system, has to complete new provider enrollment. And that includes these things listed here, where they're in Sonoma County. Part of that is online, where somebody has to do some videos online, activities online. They have to attend an in-person orientation. Right now, those orientations are offered in Santa Rosa every week and in Petaluma every other week. We're excited that next year we're hoping to offer those orientations in other regions as well, out in Guerneville, Sonoma, and Cloverdale is our goal. We know that, well, we saw 44% of people receiving care can't be left alone, right? And so we know getting to an orientation in order to be able to be a paid caregiver can be a burden, it can be a challenge for caregivers. And so wanting to make it more accessible. Caregivers have to show a government issued ID, a social security card, and then also be fingerprinted, which is can also be a challenge. I mean, it's like $55 to $75 to go get fingerprinted, and that's before you start working in the IHSS program, that you have to pay for that and pass that background check. The public authority also maintains a registry of caregivers, and so we're tasked with identifying people who want to do. We'll see in just a minute. Most IHSS providers are caring for a friend or family member, but not everybody has that. And so we have a list of screened caregivers that we can refer out to individuals for people to interview and determine if that's somebody that they would like to hire to provide them care. And there's a process for people who are interested in becoming caregivers that is outlined here. So who are the caregivers in the IHSS program? This is this shows who they are by age, and you'll see that similarly we have people that it kind of picks up around age 40 and goes up through 79. We even have caregivers 80 plus, and most caregivers in our county are female. Just under 60% of the caregivers in Sonoma County are taking care of a relative. This slide compares Sonoma County to the medium county average as well as a statewide average. And you can see we're low on both of those. So other counties tend to see more family caregivers than we see in Sonoma County. I'm not quite sure why that is, but that has been a pretty consistent trend for quite some time in Sonoma County. The other piece I wanted to highlight is who's caregivers who live with the person that they're taking care of. So about half of the caregivers in the county in the IHSS program live with the person that they're taking care of. One piece that I really wanted to highlight here is talking about training. I think it was Shelley who said that caregiving doesn't come with an instruction manual, and that is very, very true. And certainly one of the things that we see in IHSS and one of the conversations I end up having with caregivers is they're by definition, they're taking care of somebody whose needs are changing over time and whose needs are increasing over time, whether that's because the person has a chronic health condition or is an older adult and has, and the issues that might come along with that. But it's not at all unusual for somebody to start taking care of somebody by doing some grocery shopping and making some meals, maybe helping them get to and from the doctor. And over time, as that person's needs increase, so does the responsibilities and the expectations of the caregiver. I was talking with a woman just a couple of weeks ago, Saba. She's actually a registry provider, so she does this work professionally. She has been working with her client for 15 years, right? So she met this guy 15 years ago through the registry, has been caring for him for all of that time. And when she first started caring for him, he's always had diabetes, but he managed that independently. And here we are 15 years later, and he needs significant assistance with blood sugar checks, with insulin injections, with monitoring his diet, things that he was doing for himself that he is no longer able to. And she's known him long enough that she's wanting to step in, but needs training, needs to be taught how to do additional tasks that are being required of her as a caregiver. The other place I hear this come up so often is in that kind of cognitive space too, as people are experiencing memory loss, right? Like, so I was talking someone else who's taking care of her mom, and it's her mom of course would change her clothes if she had an accident. That was never an issue before, but as her dementia has increased, she's refusing. She does not want to do things that she, even 6 months, a year, 2 years ago, would have never been a question. And so learning how to engage and support her mother in these conversations about what her care needs are is super difficult. It's super difficult when there's, in any relationship, and then when you add in the sort of the complications that family can bring that just are present in families, right? That's just how families work. When you have these multiple relationships going on, where I am now son, I am now caregiver, I am now wearing all of these hats, it gets really complicated. And so wanting to have, it's essential that if we're going to start caregivers, we need to have spaces and ways that we can provide them with really kind of concrete education. How do I check somebody's blood sugar? And additional information too about how can I engage with somebody in a different sort of space, in a different sort of way that might be more effective when working with somebody with memory loss. The IHSS program actually is currently, it's in year 2 of a 3-year pilot to do what is called career pathways, but it's a kind of continuing education program for IHSS providers. This is being mirrored in a few different spaces in California. Cal Grows is a place this is happening for people that are not associated with the IHSS program, but there's, and I will say that there are hundreds of classes being offered throughout, that are available to IHSS providers. And those are in person, which can be really valuable. They're also available online, and some of that online is in a synchronous like this here, right, where you're in kind of a Zoom room with another group of people and can learn in that space, and some is asynchronous as well. So for people who want to be able to access some information when and where they can because of their life circumstance, that's a resource available to them. But it's scheduled to end in December of next year, and in fact the training portion of it will end in, I think, September of next year. And so as we think about ways to engage in supporting IHSS providers, certainly this would be one of them, to say, hey, education matters, and we need to fund continued education for family caregivers and for people who are doing this work professionally in the IHSS space to grow their skills. So that's certainly a piece that I would offer up as we're thinking about where we could go next. Yeah, and that's just my contact information if anyone wants to reach out. Thank you.
Thank you, Eric. I really appreciate the stories of the individual experience of caregivers. I think going back to what Jessica was saying is in elevating those experiences, it's something that not everybody thinks about. In you're caring for your mother in this moment, and while she's declining, the challenges and the battles that you may have to have with that individual in the moment is much more complex as your relationships change. The other thing I wanted to make a connection about there is Eric talked about that qualify for IHSS services is very, very low income. Even within that category, in a government-run in-home support services program, we have 7,500 recipients receiving that service. I know that is the tip of the iceberg and only representative of the larger scale of people who really need this service. I'm very proud of our IHSS program that does this and the work we do to entice providers to do this important work. But if you think about it in terms of in-home support services or caring services for individuals is the #1 preventative program that we can do that keep people living for as long as possible in their homes. There's a lot of work to be done in this space. So from the private home care perspective, we have Deanna.
Thank you so much, Paul. Hi, everybody. My name is Deanna Schott. I am the proud co-founder of Legacy Concierge Services. I've been on the advisory council for the AAA for the last 5 years, representing District 2, which is South County. I've been in senior care for a little over 17 years. So in those 17 years, I've been in the assisted living. I have run a 6-bed care home. I have worked in skilled nursing as a social worker, discharge planner. And currently, the last 8 years, my business partner and I, Molly, we have a company called Legacy Concierge Services. And what we do is we do care management first and foremost, and there is a component of placement. With every single job that I've had within the senior care industry, I am 90% of the people that I work with are caregivers. Some are self-driven, some are not, but 90% of the folks that I work with are caregivers. And there's kind of 3 categories of caregivers that we have seen in the past and that we work with. One of them, very involved, and their loved one has a plan, and everything is on paper, and the money's there, and everything is easy. Other caregivers we have involved, but there's no plan or no money. The third caregiver that we typically work with, that we come across, they have limited involvement with their loved one, and now they're starting from the beginning. They don't even know what their loved one has. Do they have assets? They don't know where to begin. And I feel that kind of our boots on the ground perspective of really at that care management piece and digging deep into not only what's going on with the person that needs the care, but where the caregivers are at is how we approach our job. Well, maybe there's another fourth one. We have the dueling power of attorneys. So that seems to be another one that we come across. I just actually was working with a family that daughter is in Reading, son is here, mom is here, daughter, we'll speak to the daughters again, but daughter was really advocating for what was right for mom, and the son was really against it because there was a lot of guilt around that. So I guess there's four. So we have the dueling caregivers, if you will. But some of the challenges that we get from our caregivers is, where do I start? That nobody knows where to even begin. So a la Google comes into play. So we get everybody that goes up online and starts doing the searches, and they're getting only the people that pay for their, their top spots through their SEOs on the website. And they're not getting local services. They're getting stuff that could be someone picking up the phone in Virginia and about care here in Sonoma County or in California. So there really is a perception out there, which I'm hoping to end, that there is a really perceived lack of resources out there for our caregivers. And it's sad, but it's true, because this is what we're hearing. And when we're talking about, the caregivers, when they are saying, I don't know what to do, I'm working, what am I supposed to do with mom or my loved one? 39%, and I found this number staggering, 39%, because they didn't know what else to do, jumped out of the workforce to take care of their loved one. And I think we've touched on it a couple times today, but to me, that's a staggering number of caregivers that are pulling out of their workforce. And you almost think about some long-term ramifications around that is, they are no longer contributing to their 401ks, their own future, the Social Security. If they've got children in college or going to college, now they're not able to potentially pay for that. So now student loans come in, and so the ramifications of someone not really knowing what's out there and just kind of jumping out and jumping into the caregiving role is scary to us. And my business partner made a really good point. Everybody talks about childcare. Childcare is such an easy thing to talk about. It's, you have a problem with your kid, or you're at school and you just need some help around childcare. It is such a topic that's so easily talked about. But when caregiving comes in, it's almost a taboo conversation. People don't want to talk about it. Therefore, resources are not shared. And the only way that they're really shared is if you know of somebody that just went through it, and then you're in it. So you reach out to maybe that one person. And my hope is that the dialogue around that changes, that we can openly talk about what's going on. We're all aging, so we should be able to talk freely about what is happening out there. But I think that's for another day. But the long-term impact, I feel, is hard. And I feel on the flip side, folks that are in the workforce, we are hearing that they're not being given the proper education. My business partner and I, we talk to larger companies and we say, tell us about your EAP program, the Employee Assistance Program. What do you have to offer for folks that are currently working that have needs for their, their loved one, mom, dad, whatever? And they don't. There's nothing out there. It's childcare, mental health, and financial assistance. Very rarely do we get someone that says, yes, I do have somebody that will talk about senior related issues. Even support groups, nothing out there. Crickets some of the times that we get from these folks. And another one, I think Nancy may have touched on this, FMLA. We say, hey, do you offer your folks FMLA? Even though it's a temporary thing, the employers are not doing that. And when we have the conversation with the employees, we say, look, or the employers, I'm sorry, do you understand that half of the time that they're at work, they're online trying to figure out what to do. They're distracted, they're making phone calls, they're dealing with doctor's appointments, they're not working, their productivity is not there. So how are you addressing that, employer, with your employees that are coming to you with these situations, or maybe not, and then all of a sudden they're jumping out of the workforce when this could have been avoided? And I don't know. I feel like we put so much emphasis on the younger generation that we are completely missing the mark when it comes to the caregivers. Another caregiving issue for me too, and I think, and a lot of the caregivers are expressing this to us, is the lack of affordable housing. And this is a monumental topic, and I know we talk about it all the time. When I'm sitting on the council, we do talk about housing quite a bit. And one of the programs that I loved and that went away, and I don't know, some of you may not be aware, but I want to say about 10 years ago, we had a Medi-Cal waiver program that was introduced to California. So folks that were on Medi-Cal could go into assisted living with buildings that are pre-qualified under this program to get to have a room in an assisted living. Most of the time, 99% of the time, that was the appropriate placement. Someone is no longer able to be at home, they need care, caregivers are, they're stretched thin, so that was an option for people. It became such a laborious task for the care homes that the process to get certified was so monumental that the care homes eventually all pulled out. They said, it's not worth it. We're not doing this. We're not going to go through all of this red tape to get paid less, even though it was the right thing to do, to get paid less. So my hope is that program, and that's what I'm going to be writing to my legislators about, is getting this program back up and running again. It was such a great program for caregivers. We ran some numbers on the costs, so just trying to figure out, how much would the state and Medi-Cal programs save if we were to open up these homes again or get this on the docket again. Medi-Cal beds in skilled nursing. So if you're not aware, there are custodial beds in skilled nursing for folks that need care, not a lot of care, but some care, really can't be at home anymore. There are beds that are set aside in skilled nursing. They're called custodial beds, and Medi-Cal does pay for them at the tune of 110% more than the retail price of what it would cost per month to have someone in an assisted living. So 110% more. And that's retail. So the costs for the assisted livings under the Medi-Cal program were less per month. So potentially 120% more. The median cost in California, this is California, it's not Sonoma County. So for an assisted living, on average, $58,000 a month or a year, in assisted living, compared to $146,000 a year in skilled nursing. So the costs are astronomical, and I just feel like if we got this program going again, and I'll jump off my soapbox in a minute, the caregiver relief, and it all comes back to the caregiver at this point as well, because the loved one will be cared for regardless, is that it does help with the caregiving, and the caregivers are not burdened with having to jump out of the workforce or stretch their time or be a 40-hour work week and a 40-hour home care. It's not realistic, and I think we need to figure out something else for our seniors, and especially around housing. I feel like that is where we are definitely missing the mark, and it's going to help with the fatigue for our caregivers. So most of the caregivers, I would say, 90% of the caregivers that we get, or calls that we get, are folks in crisis. And we rarely, well, we're trying, that's been our platform, but for the most part, people are not making decisions until it's too late. And we really saw an influx of that, unfortunately, coming out of COVID, that most people during the pandemic probably needed care at the start of the pandemic. And by the time they came out of the pandemic, we were scrambling. And I think everybody in the care industry, everybody in my industry, all the assisted livings, we were in a scramble because it was 2 years of folks not getting the proper care they need, and potentially caregivers weren't even allowed in the home. So I really feel that if we can get people out of crisis mode and into prepared mode, that is our goal and that is our wish. We try to promote this all the time. That is kind of where our little platform is. And people in crisis tend to have to make very rash decisions. And these caregivers are unprepared to make these rash decisions. And if they don't have someone guiding them through it, they're making decisions based on emotion or the internet. And they're not basing it on what the true care needs are. And not just the care needs, because there's more to the folks that need care than just a diagnosis. The caregivers, they're looking at the diagnosis, and so is everyone else. But really, we need to look at who that person is and was. The care can be taken care of, but we're not really honoring the person as a whole. We're treating the diagnosis, and it's a tragic way to approach caregiving, and it's a tragic way to have to look at what we're doing for our loved ones when they deserve so much more. So we have an exercise that we do with our clients, and we give it to everybody. It's something that it's food for thought when we are talking about caregiving, and we're talking about the caregiver. And it's a bullseye target, if you will. And in the middle of this circle is you, so the caregiver. And we say, okay, on your next ring out, who are your family and friends that you can contact? Pick 3. We don't go crazy. Say pick 3. Who are the 3 people in your corner that are going to drop everything that they need to do when you need help, caregiver, whatever that help looks like? Who knows where the bodies are buried? Those are the 3 people that you need to write down and know that they've got your back. They're going to help you out, so you don't feel so alone as a caregiver, because things are going to come up. The next ring, if you will, is who's in your neighborhood and your community. Who can you turn to? Not just your neighbor, but who's in your community? Do you go to church? Do you have some support groups that you work with? Who are 3 community support for you that you can take advantage of to keep you whole and healthy? And that it could be anything, but church, we kind of give people, we prod them, what about a church? What about this? Oh yeah, I've got 3 people or 3 entities. And the third ring, if you will, so we're going out, is your health and your social and your professional support. So give us the top 3 people or professions or social activities that you do that's going to keep you healthy and whole. Do you have, your primary care doctor? Do you go to therapy? Who's your therapist? Do you do yoga? Do you play pickleball? What are some of the things that are going to keep you as a caregiver whole and healthy? And I'm so appreciative that we're doing this today, because in my world and what we do, we are constantly redirecting the caregivers. We are taking care of what needs to be done, and we're taking care of the tasks. But we are looking at the caregivers and saying, what are you doing? How are you? And they're taken aback by this question because it's always been focused on someone else and what their needs are. The caregiver has to be 100% whole to be able to take care of the caregiver. So that's really what I had to say about the caregiving role and what we see out there.
Thank you so much, Deanna. I'm going to take just a few minutes to wrap us up and then thank everybody. But as from before, Deanna, I really like what you said about how we can support the people who are still working and needing to provide care for others. I imagine a society where we can support parents of small children and sons and daughters who may need to care for their parents at some age. Let's be that society and create a workforce that can do that. I also really like what you said, and I'm going to generalize it. Advocate, advocate, advocate. We need to advocate for expanding the Medi-Cal waiver for more beds to come to California and to come to Sonoma County. It's a needed resource, but advocating about anything related to caregiving is so important. Thank you so much to the panelists who've taken the time to do this today. I learned a tremendous amount. I hope that the audience learned quite a bit too. I haven't allowed enough time for there to be more comments on what you learned and takeaways and things you'd like to be involved in. Katie is just adding in the chat our email address for the AAA. We have a landing page in our AAA where this video will be posted for others to see. And if you'd like to watch again or add comments. But once again, I'm very touched by all the work that all of you do. Thank you so much for this critical importance service of caregiver supports. And thank you very much for coming today.